Algenon Cash, and you're locked in. Welcome back. Thank you all for joining us for another great episode. I really think all of you would get a lot of value out of the conversation that we're getting ready to have. I've got a new friend joining us, Dr. Iulia Vann, who's was the interim health director, and now is the full-time public health director for Guilford County. She has taken over after longtime director Merle Green retired. Dr. Vann has also earned a master's degree in public health from East Carolina University, and she is leading the fight here in Guilford County against COVID-19. Dr. Vann, how are you today?
I am great. Thank you so much, Mr. Cash, for having me with you this evening. It's a pleasure to be here with you and the audience that we have tonight.
Well, I was very proud and happy to be able to have you. And obviously, as I was telling you off air, I'm sure you're a bit of a rock star right now with the situation we find ourselves in. I think it's interesting how we go through circumstances like we're going through right now, and all of a sudden it reminds all of us how important things like public health and some of these things that we don't think about, how critical they are. And I think you and so many others around the state and around the country, quite frankly, have been cast into the spotlight for obvious reasons. And I just hope that once all this passes and you all finish up the good fight, that people remember what it is that you all do in the health department, and certainly celebrate you all for the service that you provided. So thank you for being here. And I got to send a special shout out to Chairman Commissioner Jeff Phillips, who helped us to get connected. I had Jeff on the show maybe a couple of weeks ago, right after the election, and we had a great conversation. And he was instrumental in getting us connected for this conversation today. I do want to remind everyone that today's show is being sponsored by Angela Harriet over at Keller Williams. So if you have any home buying needs or you're looking to sell your home, which I know a lot of people are doing these days, you should contact Angela Harriet over at Keller Williams. Make sure she knows Algenon Cash sent you. So Dr. Vann, to sort of kick into our conversation tonight, and for my audience, you know how it works. If you're here with us, you're locked in as well. If you have questions, comments, leave them in the comment section, and I'll work them into our conversation with Dr. Vann as we proceed. Dr. Vann, I think we'll start off with just a real basic question. I'm sure my audience is curious about, where are you seeing our currently daily cases right now? Obviously, we get a lot of reports about what's happening nationally and statewide, but what's going on in Guilford County?
Yes, absolutely. So first of all, again, thank you for having me tonight, and thank you for the comments. I appreciate it. I hate that I am being on the TV and having conversations around COVID because of the trends that we're seeing in Guilford County. I wish I would have been able to share a different message right now, but we're very concerned in the way that the trends are going and the number of cases that we're seeing every day. On a regular basis, in the past months, we've been fighting this for almost 9 months at this time. We were pretty much averaging anywhere between 80 to 90 cases every day. However, in the last month or so, we're seeing those cases increasing, and almost every day for the last 2 weeks, we are receiving reports of over 200, 250 new cases every day. That is not only concerning because of the rate of transmission in our community and the way the virus is spreading widely right now, like wildfire almost in our community, which is very, very concerning to us, but it also poses a threat to our workforce. Our workforce and our team members and staff have been working nonstop for the last 9 months, but now with additional cases every day, it's really hard to keep up with all of the work that we need to do. Another metric that we're using and that we're looking at, because I've mentioned this before, and I want to re-emphasize the fact that the picture that is being painted in Guilford County is not based on only one data point or only one metric. It's a combination of different ones. So the number of new cases is one metric that we're looking at, is definitely going in the wrong direction. Another one is the positivity rate. We're hearing on TV all the time about the positivity rate. What should be the right percentage? Is it 5%? Is it 3%? Or what is that magic number? Unfortunately, there is no magic number because we want it ideally to be less than 1%. But right now, we still need to be able to balance that with other metrics. Unfortunately, our positivity rate for the last 14 days, for example, has been anywhere between 9.5, 9.8%. With certain days being higher than that, 14%, 15%, which is very, very concerning. We know that that positivity rate is very much linked to the number of tests that are being performed each day. That's how we're calculating that. So of course, more tests that are being performed that day with a different unique combination of people that are coming to get tested is influencing that number. Think about it from a perspective of a net. If a fishing net, if you're throwing out that fishing net out there and you have this wide net, you're probably going to be able to catch more fish if there's fish in the sea. And that's exactly how that testing and the positivity rate kind of associate with each other as well. So concerning numbers there as well, it's been trending up for the last month or so. And like I said, we're seeing that at above 9.5%. Hospitalizations is also an area that we take a look at to create that full picture for Guilford County. Unfortunately, those numbers have been going up incrementally over time, but especially in the last week, our hospital systems have been seeing very high numbers every day for the last week. They have been experiencing record numbers every day. So every day, those numbers are the highest number of hospitalizations that we've had so far. Again, that number is not taken out of the whole picture, because we know that the capacity that the hospitals have, especially the ones that we have in Guilford, which we're very fortunate to have partners such as Cone Health and Wake Baptist in our communities, they're still pretty flexible with the amount of capacity that they have. They're stretched thin. They don't have the resources, the staffing resources that they need in order to support this continuous growth. So we're at a point where us at a community, we really need to step up.
No, that's a lot of great information that you shared, Dr. Vann. I want to go back to your comment around the number of cases that you're seeing daily. You said 250 or as many as 250. I happened to come across a news article where you were interviewed back in July, I think maybe with the News and Record. And at the time, there was about 60 to 70 cases per day. And you were on record saying that was just way too high. I mean, how do you when if we're at 250 a day, how are you reacting to that?
Yes, it's there are numbers that we've never thought that we're going to get to. It is absolutely a fire in the way that we're responding to this, and the way that the numbers are coming in it's just almost disheartening at the same time, and concerning, and frustrating, and there's so many different feelings that are mixed in those numbers, not only because we know that those are people, they're not just numbers, but they're actually people, the all of the family members and friends and neighbors that we have lost so far, those are not just numbers, but they're people. So it's emotional sometimes, because I know that the fight that is being spread out through not only in my team but also in the community sometimes doesn't necessarily look as if it pans out. So where do we go from here, and what do we do next is really the conversation that we need to have together, not just in my department, not at the county level or the leadership level, but really at the community level. Everybody in every family should have these conversations.
No, I agree with you. Guilford County is pretty unique in the sense that you have two urban cities located in the same county, being High Point and Greensboro, but then you're also surrounded by your large county for North Carolina, and you're also surrounded by quite a number of rural areas. Are you seeing any divide between, when you talk about these cases on a daily basis, is that more in the urban areas versus rural, or vice versa?
Yes, so we're definitely seeing hot spots in areas of concern and more cases in the urban areas of Greensboro and High Point. But of course, those are associated with the number of people that we have, the communities, they're way more denser. It's a denser population in these areas. The numbers are definitely affected by our universities, our schools, and other congregate living facilities, nursing home, residential homes, and so on and so forth. So definitely the areas surrounding Greensboro and High Point are the ones that have a higher incidence or new cases or prevalence, the number of total cases that we're seeing compared to more rural areas. And then on the second place would be more of our suburban areas, the smaller municipalities, Pleasant Garden, Oak Ridge, Summerfield, Stokesdale. They're kind of the second tier of the number of cases that we're seeing. And then the third tier would be more of the rural areas in the southern part of Greensboro, and then let's say northeast part of Greensboro.
I know early on with the virus, I'm a resident of Forsyth County. I actually serve on the mayor's reopening task force here in Winston-Salem. And I think I agree with you. We all never thought it would go this long or this far or even get this worse. Maybe we were a bit naive, or just hopeful, I suppose.
Yeah.
When you talk about the cities being a little bit more the hot spots, I know early on we noticed from certain trends that certain segments of the population were more likely to be affected. So that may be Hispanics as well as our African American population. Are you still seeing those similar trends, or has that shifted or changed in any kind of way?
Yes, so I'm glad that you mentioned this and that we're talking about it because overall, if you're taking all of the cases that we've seen in Guilford County so far, and you're doing that, let's say race analysis or ethnicity analysis, the numbers that we're seeing are not very much different than what our population distribution is in Guilford anyway. So Guilford County is a predominantly white county. With the African American Brown community within the 33% population and maybe an 8% population of Latinx community members. So overall, the number of cases are also following that same demographic distribution. However, if you start breaking down the cases on smaller increments of time, and we're using, let's say, only 30 days increments, we have seen a very similar trend, just as the state saw altogether or nationally. When we first started getting cases and those were reported to us, most of them were in our white Caucasian community members. Then the next group of people that started being more affected by COVID-19 was our Brown African American community, with those numbers spiking at the beginning of June, July. Then those numbers starting to level out, and we saw a spike in our Latinx community cases, again, just very similarly to the way that those have been seen nationally and at the state level. And then those have leveled out as well. But what is really important to mention here is that the way that those communities have been affected have been absolutely disproportionately more impacted by the COVID effects that we're seeing all together as a whole, from a health perspective, from an economical perspective, from a social perspective. So there's so many different areas in which these communities, which are normally our vulnerable communities, are more impacted by them. They have more social determinants of health. They have more social economic challenges. They have chronic illnesses. They're more likely not to be insured, or they're underinsured. They work in jobs in which they're more likely to be exposed, and they're more let's say client facing than other jobs. So it has been definitely an area of concern for us. And our messaging and our communication, our testing efforts have very much been focused in that area for a long time now.
So just so I hear you correctly, there is some special external outreach going to that demographic of our population.
Yes.
I understand. If you're just now joining us, you are locked in. I'm Algenon Cash, and also locked in with us today, we have Dr. Iulia Vann. She is the public health director in Guilford County, and we are talking about their response to COVID, which is obviously we are starting to see a big increase in numbers, not only here in North Carolina, but across the state. And our public health officials are working overtime to try to keep us all safe from this virus. You know, Dr. Vann, you mentioned something about positivity rate. I know here in North Carolina, Governor Cooper has often talked about a 5% number. I heard you mention numbers that were much higher than 5%. I read an article in the New York Times that in New York, Mayor de Blasio has said that he doesn't want to see a positivity rate above 3%. So they have canceled schools, told kids to go back home. In your professional opinion as a public health expert, are you comfortable with kids being back in school, whether it be Guilford County or any county in North Carolina?
So it all depends on the circumstances in those communities. So we have a positivity rate of 9% right now for the last 14 days. We did see a positivity rate of 5% a few weeks ago. I feel like we will be able to get back to that as soon as possible. But just like I've mentioned before, the positivity rate number is really not a magic number. We can say 5%, we can say 3%. Ideally, it will be less than 1%. But what we also need to talk about is all of the efforts that are being put in place in order to mitigate the spread of COVID-19. So positivity rate is just one metric that we want to look at. It just paints part of the picture. If the schools have done an awesome job working with us and working within their own leadership group and putting so many different plans in place and protocols and workflows to protect the kids, the staff, and the teachers. So if all of that is being put in place, then it is a possibility that those kids are going to continue their education and be able to attend those classes in person or in Plan B status or some type of combination of both. The positivity rate just shows the way that the community spread happens. And that's why it's really important to mention to our community members the fact that we all play a part in this. You know, the schools are doing a really good job trying to do everything that they can, but those kids go back home and they go back into their community and their households. So we need to all be mindful of that, that there is exposure that happens most of the time outside of the school setting and not in the classroom.
Yeah, I know a lot of us are concerned that the spread may increase and the exposure may increase as we head into Thanksgiving. I read a report today that we expect, or the country expects, to see over 1 million people traveling for Thanksgiving. I know a lot of families have to some degree canceled Thanksgiving and maybe doing it virtually. What is the county prepared or getting ready to do for this week after Thanksgiving? Or I guess maybe it might be a 2-week lag between the event and then when we start to see the increase in numbers. But is that something the county is proactively getting ready for now? Or
Yes, absolutely. So we have a two-prong approach. Let's say we try to do as much education, promotion, communication, and messaging in the last week, and we continue to do so before Thursday because we know that there will be people that will travel. Today, we have put out one of those cell phone messages that go off on your phone, just like an Amber Alert or flash flood alert to alert our community members that if you do travel, you need to stay safe. I try to do as many interviews and talking to our media partners to put the message out there that you need to try to avoid gatherings, stay home if you can, use innovative ways to celebrate this time. I know that everybody wants to get together with their family, and this is a time to really value each other and spend time with each other, but maybe this is really not the best time to do that. We've tried as much as possible to increase our testing capacity because we know that a lot of people express interest in being tested, and we recommended testing before traveling. So we've done all of these different activities, or took all of these actions proactively before Thanksgiving. Next week, actually the week of next weekend actually, we're organizing a big testing event with all of the different testing partners that we have in Guilford County, because we know that it's important to get tested before you travel so you won't expose your family. But we also know that those gatherings will happen, so we need to have testing opportunities after people come back from the different celebrations for this weekend. So we have a pre-Thanksgiving and a post-Thanksgiving type of approach.
No, you guys are well prepared. That's awesome. The maybe a little too late at this point to do the pre-testing, but if I'm coming back from my family's house next week, where can I go get tested? Are there specific sites already set up for that? And then my tag along question to that would be, is it free, or is there some kind of cost associated with it?
Sure. So there are a few testing sites that offer testing in Guilford County. We have a fixed site at our Wendover location in Greensboro, 1100 East Wendover, where we test pretty much throughout the entire day, from 9 o'clock in the morning all the way to 7 o'clock at night. On healthyguilford.com. Again, that is healthyguilford.com. You can go and see all of the different testing sites, and also how to get an appointment, or what number to call, or what do you need to do in order to get an appointment. We have another testing location at our Green Street location in High Point. Again, we test there pretty much throughout the entire day. Our Cone Health partners are testing at the Green Valley campus. We have approximately 12 CVS locations in throughout the county that are also doing testing. And then keep an eye out for other mobile testing that are more of pop-ups. But all of the ones that I've mentioned are fixed sites where you can go and get a test pretty much at any time. Healthyguilford.com is the perfect place to go and try to find out the locations. And again, stay tuned for a Coliseum testing event towards the end of next week. We're working through the logistics for that, for a post-Thanksgiving testing. All testing is at no cost. For the person that goes through the testing, we might ask you for insurance information. If you do have insurance, we would ask for that information. If somebody does not have insurance, that is no barrier to testing. We do ask for a few personal information, name, phone number, date of birth, just to make sure that our quality assurance is done when we're providing testing results. So we need to have some basic information, but we're not asking for a whole lot.
I am Algenon Cash. You're locked in. Also locked in with us today is Dr. Vann, the Guilford County Public Health Director. And we are having a conversation about COVID and the county's response in terms of how they are fighting COVID and trying to keep residents safe. You know, Dr. Vann, as I get ready to start to run out of time, I want to pivot our conversation and talk a little bit about restrictions. I know all across the country, we are seeing governors across the country start to place more restrictions in place, sort of rolling back some restrictions in terms of how restaurants and bars operate. I know here in our state, I work with a lot of business owners and restaurant owners. There is a sense of concern that we may be heading back to phase one. What are you hearing in that regard? And also, what's your professional opinion? Do we need to be back in phase one to bring these numbers down that you've shared with us today?
So I think that nobody wants to really go back. Nobody wants to impose more restrictions. We're definitely not for another shutdown or, anything like that. We know that our communities thrive if we're operating, if our kids are able to go back to school, if our businesses are open. So I don't think that anybody wants to go in that direction. However, in order for us not to do that, or not to go in that direction, we really need to pivot in the way that we're doing things, because right now we're really at a critical point. So we don't want to give our county leaders or our state leaders any reason to be concerned to the point where decisions will be made in that direction. So it's really important for all of us to really identify the fact that that could be a very much a possibility if we're not taking this seriously, and if we're not getting a grasp on the number of cases and how these numbers are moving and the trends that we're seeing.
Recently the Greensboro City Council passed an emergency declaration and didn't necessarily create any new restrictions, but more so tried to impose some local fines and penalties if the governor's restrictions were breached. Whether it be capacity restrictions and those kind of things. Do you think the county's going to follow suit? And I guess what the reason I'm asking that question is if you're a business in the city, but it just so happens that my restaurant is across the street in the county, how do we actually get this under control if both those businesses are not operating under the same enforcement rules?
Yes, sure. So I know that's probably a question that everybody has, and how can we um, have a way in which this can be like simple and easy to follow, and not really think about those lines across, around Greensboro, let's say. So one of the conversations that we've had most recently with a group of community stakeholders, with a lot of county leadership and cities and mayors and representatives from the business community and the food and restaurant community, faith community. It was a really well, a very diverse group that we had a conversation with. It is something that we're discussing at the county level, to put in place some type of ordinance or executive order or rule that will give us the opportunity to do something in the middle. And the reason why I'm saying in the middle is because right now we have the education part that I feel like we've been doing a lot of over the last few months in so many different areas and sectors and spaces. And then we have on the other end of the spectrum, 180 degrees, are the criminal penalties and the orders of abatement, which close down businesses. And they're just a really hard hammer, and like really strong restrictions, and talking about misdemeanors and all of these different really harsh penalties. It's a little bit harder to work with, and we don't really have anything in between. So that's one of the things that our county leadership has been talking about, working in the civil penalty field, and how can we get something that is very similar to the city of Greensboro, but this would be county-wide. So we're working out with our legal team as we speak, to see exactly how that's going to look like, how enforcement is going to look like, and to just build on those details of implementing something like this.
Do you think we'll see something like that pre-Christmas, or is it too early to tell?
I believe the intent is to see something like that before Christmas. Yes.
Before Christmas, very good. My last question for you, we're all getting a little bit excited and feeling optimistic by the fact we got a vaccine out there. And I know that the some of the articles that I've been reading most recently talks about how do we actually get people to take the vaccine serious and take the vaccine. Has your team started thinking about how do you actually encourage county residents to take the vaccine once it's actually become available?
Yeah, so I'm glad that you also brought this conversation up, and we can spend probably 2 hours just talking about one topic, vaccinations. But I do have a couple of points that I would like to make. First of all, no vaccine is going to be approved or receive some type of emergency use authorization if it's not been vetted and analyzed and tested and went through all of the rigorous processes that any other vaccine goes through. They're not, the FDA and our medical society and research society, they're not going to cut corners when it comes to that. So I think that that's one of the points that I would like for everybody to be comfortable with, that when that will become approved or some type of emergency authorization will be given to any of these vaccines, that means that it is safe and it is efficient. Nobody's going to put the health and the safety of our community members at risk with the vaccine. However, we very well know that we have groups of our community members that have been in the past very much abused by the research society. We feel very that the Tuskegee experiment has been not that long ago, and we understand the mistrust that a lot of our community groups have because of that. But it's also important to mention that we have learned a lot since then. You know, we've put a lot of effort into making sure that ethics are being followed, that all of the information that we have available is transparent and is being given out to the community. So we have worked for the last month trying to get all of these points together, trying to figure out how to message this and how to really gain trust from our community members. One of the main things that I hear is that, well, this vaccine has been created way too fast. You know, it's way too fast. There's no reason that I can trust it. However, you have to understand that the reason why it was created this fast is because of all of the knowledge that we have on previous vaccines, especially the HIV vaccine. So they have used very similar processes in developing this vaccine. And because we've learned so much from the past, that's how we were able to move so fast this time. But that doesn't mean that safety was compromised in this process.
No, I'm so happy you shared that with my audience, and I will just be honest with you, Dr. Vann. I'm someone who has felt this the way you just described, and I've had people ask me, "Am I going to take the vaccine?" And I said, "Man, I'm really scared to do so because
Yeah.
they've developed it so quickly." And so I do agree with you. There's going to have to be some proactive educating going on throughout the county and the state to help people get comfortable with it. And
Yeah.
certainly, I would love to. I'm so thankful that you came on today. But you know, what we'll do is keep you on the short list, and as things progress and develop, we'll get you back on so that you can keep updating the audience and letting them know what's going on out there.
Absolutely.
Um, I am so thankful for you locking in, and to my audience, I'm always thankful that you lock in. Please be safe out there. We are going to get Mayor Nancy Vaughan on. She may be coming on tomorrow, to be honest with you, to talk about the emergency declaration that they passed in Greensboro. I am hearing that Mayor Joines is going to be doing the same over in Winston-Salem with his city council. So look out for that. And as Thanksgiving comes up, just be safe. You know, wear that mask, social distance, wash your hands, do all the things that our public health officials are advising. If you don't have to travel, try to avoid traveling. I happen to be one of the lucky ones. All my family is here in the backyard. But a good friend of mine, you know, she's missing family with her family this year because they're in Texas. And
Yeah.
so that may be the uncomfortable and inconvenient process that you've got to go through to keep yourself and your family safe so that we can get through this virus, through this epidemic, and actually get back to some sense of normal. Until then, you guys, y'all stay locked in.
Happy Thanksgiving.
All right. I think we're good to go there, Dr. Vann. That was